So what Nairobi has done very effectively is put together a multi-sectoral team that is in charge of making sure that flooding is not an issue. So that team includes people from disaster management, people from infrastructure, who do roads and public works, the drainage, of course, people from Nairobi Water who are in charge of the sewer, but most importantly as well, a group from public health that is mitigating any effects that might come from flooding, particularly waterborne diseases, and catchment areas for bilharzia and malaria. So I think the team has been working very well together, and that's why, unlike most parts of the country, we've not seen as many incidences in Nairobi. If you think about Nairobi a few months back or years back, there was a very big problem with flooding. Places like South Sea, people used to talk about, would swim to work or something like that, which is not necessarily the case right now. So I think there's been quite a bit of improvement on that front. And even from the health perspective, we've not received that many issues from the flooding.
Well, they always say mambo kwa ground ni tofauti. You plus the multi-sectoral team, just how frequent do you get to visit the slums, especially at this point of the rainy season?
Every so often. So there are different people who sit in the multi-sectoral team. So for me, the chief officer in charge of public health is one who sits on it. However, we are still responsible for quite a bit of monitoring. Like today we were in Kwanjenga, and there were quite a bit of, in Mukuru, Kwanjenga, and there were quite a bit of rains as well. But we can see improvements, and the work that our team has been doing is actually quite evident. So kwa ground ni ukweli that the effects are
no flooding and all that.
There is flooding, but it is not as bad as it used to, and it is quite controlled at the moment. Yeah.
And that we have good reports, it could be better.
Yes.
Okay, well, let's go to the question of health. You have listened to that report by George Maringa. George Maringa reminds us of the Abuja Declaration and what is expected of the numerous nations that sit under this, or that worked together to come with this declaration, is that at least the health sector should get about 15% of a country's budget. As it stands, the estimations that we have for the 2023-2024 are at 11%. That means there is a deficit of about 4%. And when we're talking about these allocations at the national government, then they certainly trickle down to what the counties will get. How have you been managing? How are you managing? How are you expecting to manage when we have such a deficit? And Makiu, we have the donors now threatening to pull out?
Yeah, I think first of all, there's a distinction between what the national government is appropriated and what the county government is appropriated. So we appropriate differently. Yeah. And so the 11% that is at the national level does not necessarily trickle down to the counties. We get our own from the county the county assembly
collections. And
so currently Nairobi's health budget in relation to the entire budget is at about 19%. While it might sound good, it is still lower than most other counties. However, we've put in money mostly in the preventive aspects of health, which actually help in ensuring that the cost of healthcare is cheaper. The only issue is health all over the world is never sufficiently financed. Even in the most financed health system in the world, it is still not sufficient on that front. So what we do as a county government is just to ensure that we're efficient with what is allocated to us. We've made sure that first of all, we understand what is the issue with health. So as soon as the Governor Sakaja administration got into power, there was a task force that was put together that actually came up with a report about everything that is wrong with the health system in Nairobi and what can we do to improve it. And so that's part of what we've been implementing, and we're still in the process of implementing. One of the main ways that we've done this is the governance structures in our facilities. So we have about 125 health facilities in Nairobi. 4 of those are level 5s. That's Mama Lucy, Pumwani, Mbagathi, and Motwini.